ready?
Yes, go ahead,
Okay.
Sharon. Okay, first of all, how many of you know somebody who has or has had Alzheimer's disease? Well, unfortunately, the sad truth is about 5.3 million people in the United States currently suffer from it. 1 out of every 2 households will experience it in some form, and it doubles your chances of getting it every 5 years after the age of 65. I actually had a lot of fun preparing for the speech today. I went to the St. Alphonsus website, did some research there, went to the Alzheimer's Association website, also checked out some books from the library, and also met with a physician for almost an hour at St. Alphonsus Hospital. I'd just like to touch on a few key areas tonight that I found that were actually quite interesting or pretty important. One is how you're diagnosed with it, how it's defined, how it causes you to lose your memory, and how it was discovered and what we could do to maybe beat the odds of getting Alzheimer's disease. So first of all, how is one diagnosed with Alzheimer's disease? While I was meeting with Dr. Sherry McAuliffe at St. Alphonsus, she told me the doctors use a process called diagnosis of exclusion. There's a lot of factors that actually contribute to memory problems. A few are stress, depression, high blood pressure, high cholesterol, and a history of strokes also contribute to that. So when the doctors exclude all of these factors, they then proceed with an Alzheimer's test. The Alzheimer's test is pretty simple. They will get a complete medical history. They will ask you to draw pictures, do a little bit of math calculation, and a little bit of memorization as well. So what exactly is Alzheimer's disease? The Alzheimer's Association defines Alzheimer's disease as being a progressive and fatal brain disease. It was discovered back in 1906 by a German doctor named Dr. Alzheimer. Dr. Alzheimer met a patient in 1901. She was having poor judgment. She was also having a very difficult time understanding what people were saying to her. And she was also having a hard time talking as well. She passed away only 5 years later in the spring of 1906. Dr. Alzheimer got a permission from her family to do an autopsy. When he first looked at her brain, he noticed that it was actually quite smaller than a normal, healthy brain. So this is probably the brain that he was looking at. And then this is what our brain looks like, a normal, healthy-sized brain. He then grabbed his microscope, proceeded farther by looking into the brain, and found a whole bunch of fatty deposits. These fatty deposits are called plaques. What they do is they kill off all the nerve cells, and they prohibit signals from traveling throughout the brain and getting into the central nervous system. Now, the process on how the brain works is pretty simple. A signal is started here in the neuron, travels down these cables called axons. When they get to the end of the cables, there's a whole bunch of neurotransmitters. These are ignited chemically. They then proceed to jump over to receptors, and then into other cables called dendrites. These dendrites then carry the signal off to other neurons and out to the central nervous system. Currently, there is no cure for Alzheimer's disease. There are some medications and prescriptions that they are prescribing right now. They help the neurotransmitters get some extra power and jump over to the receptors and the dendrites. But right now, it's just the disease is just too progressive and too damaging to the brain. Eventually, what happens over time is the fatty deposits eventually just kill off the neurons, and then the medication can't work at that point. So what we've learned today, what I've gone over with you, is how it's diagnosed, how it's defined, how it causes the brain, or how it affects the brain and kills all the cells off. Well, I'd like to conclude with what we can do right now to help beat the odds. What's my time? 2 more minutes? Well, it does, Alzheimer's disease, the chances of us getting Alzheimer's disease after the age of 65 doubles every 5 years. And it starts as early as age 30. So what we can do at this point in our life is to live a healthy life. You can exercise regularly, which that will help blood get to the brain, help bring oxygen to the brain, which then in turn helps repair and keep all the neurons and all the nerve cells healthy. Something else that we could do is eat a pretty healthy diet. Avoid fatty foods, avoid fast food, eat lots of omega-3s, eat protein, fruits, and vegetables. One of the other contributing factors to Alzheimer's disease is stress and depression as well. So avoid stress, avoid depression. If you feel yourself getting into a depression, go see a psychiatrist and help yourself get out of it. Because not only can it be damaging to you, it can also be damaging to your family as well. My grandfather was diagnosed with Alzheimer's disease about a year ago, which is why I chose to do the topic today. And in that 1 year time, I've already seen him go downhill quite quickly. And as Nancy Reagan called it, it's a long goodbye. And that's truly how I picture it as well, because every time I see my grandfather, it's just always a longer and longer goodbye every time I have to leave. So hopefully within my lifetime, there will be a cure for Alzheimer's disease. And hopefully we can beat the odds of us getting it as well. Thank you.